You called me out, but thank you. I am going to talk a little bit about habit formation, very, very quickly and briefly, to kind of set the stage for how, at least how I view it. And then Melanie and Emily will share some stuff with us. So let me pull up some props. We're going to bring up the behavior model and talk about habits in those terms. For those of you who weren't here yesterday, I did a very, very quick exercise. I explained this, and I had people teach each other. This is how I view how behavior works. The more you're toward this corner, the more likely you are to do the behavior when triggered. When it comes to habits, now, I think there are 15 ways behaviors can change, and one of those ways is what I call blue path, or a habit. I won't get into that today. What I do caution you about is lumping all of behavior change into one big basket. At the most, I guess, high level, you have behaviors you want people to do one time. Are we calming? And you have behaviors you want people to stop doing from now on. Those are very different types of behaviors, and they require different recipes, different solutions. There's a different psychology for getting people to take the HRA versus stop smoking versus exercise from now on. Those are very different. So don't let people get away with making big generalizations about behavior change, like incentives for behavior change. There are times when incentives work, and there are times when they don't work. It's just like in cooking. There's times when you want to use salt, and there's times you don't want to use salt. So we won't go into the details of that, but what I do want to talk about is habit formation. I think the traditional way of looking at how habits work is to get people to do stuff over and over and over for 21 days, and I think that is almost certainly wrong. Not all habits. I don't know where the 21-day thing came from. If you know, let me know. I was talking to Eric Heckler about it. Somebody needs to explain where that myth came from. But a lot of people take on programs that, wow, we're going to get you to do something hard, like exercise 30 minutes a day, and we're going to keep you motivated. We just got to keep you motivated. Now, if you slip in the motivation, I'm going to get our prop here. So let's say Bongo's doing it, and one day the motivation slips, and he doesn't do it. Well, guess what? His streak is off. He probably gives up. He doesn't form the habit. So I call this, I guess, the grinded out method. I need a better name someday. But in this method, it's like motivation, motivation. You just got to keep people motivated, which is really hard because motivation's slippery. At the other side of the spectrum, it's what I'm calling tiny habits. And this method is just get people to do something that's really easy and simple. And the motivation can be high or low, but even if the motivation's low, they're likely above the activation threshold. So floss one tooth, take one deep breath, walk for 3 minutes, take one bite of a carrot. You know, simple, simple, simple. And as you do that, as you floss one tooth every day, or after you brush, after I brush, I will floss one tooth. That's kind of the tiny habit sentence. It gets easier and easier to floss one tooth. Why? Because the floss is out in front of you. Your fingers stop getting sore from the floss. Your gums stop bleeding, and so on. So you're able to floss more teeth, and over time, I maintain that habit naturally expands. So you get more capable. So eventually you have the full habit, but you start it tiny, and you're not so much at risk at falling below this activation threshold. I am not a fan at all of this kind of habit formation. I think it's a very fragile approach. How many of you did tiny habits with me? Okay, wow, a lot, thank you. There's a lot to improve in that teaching that I do that week. I've gotten so busy the last couple of months, I haven't been able to iterate it and improve it. A little bit of a success disaster, to be honest, but we'll get there. But you got the sense for it, right? In tiny habits. There was one guy that emailed me about 3 weeks ago. He started tiny habits, I think February, and he started with 2 push-ups. And he emailed me 3 weeks ago and said, thank you very much. I'm doing 500 push-ups a day now. 500. Now, this is an extreme case. Not everybody goes 2 habits, 2 push-ups, 10, 10, 10, 10. Now he's 500, right? Which probably requires a little bit more motivation, but his ability is a lot more. So he does, I know, crazy. He does 10 sets of 50 throughout the day. And I keep getting emails back of people who are like, oh my gosh, you know, one habit didn't stick, but 2 of them did, and thank you very much. I've never been able to do sit-ups or whatever, you know. So, you know, now there's probably been almost 4,000 people go through the program. It's very qualitative. I read everything people send in, developing a sense of where the pitfalls are and so on. And I'll get better at explaining that and sharing that out with people. So that's how I look at it. You see the difference? The grind it out. This is, I don't know why this is the traditional way of creating habits. And then when people fail, it's like, oh, I just didn't have the willpower. Oh, I just wasn't motivated enough. No, somebody gave you a program that wasn't a good program. You know, I think our imperative as designers of health interventions is to help people succeed. David Sobel's going to talk about an aspect of that later today, and I'm very excited about it. Every time we design a system and people fail or feel like they failed in doing it, we have done them a disservice. We have made them less able to change in the future. So I take that really seriously, and I'm getting grumpier and grumpier about people that design these big leap programs or expect people to change overnight, because you're not doing people a service at all when they fail. You are doing the opposite. Their overall ability to change, I believe, goes down, the motivation, and so on. Okay, and with that,